going through. What we wanted to do was to make sure that pediatricians were accurately diagnosing kids and that they were meeting criteria. And indeed, from the first guidelines, one of the benefits that came out of it is that most pediatricians are now using DSM-4 based criteria, and they're using rating scales that they were not using beforehand. So we really, and that's particularly true for the preschoolers, which is a new group, that we wanted to make sure that they were using evidence-based process. Now, I know from prevalence studies that, particularly one that we've been finishing that's not published yet, that there are still a number of children out there who meet the criteria for the diagnosis but have never been diagnosed. And to the extent that that will occur, that would increase the numbers that are there. We're certainly also, with the process, hoping that we will decrease the number of inappropriately diagnosed children, although at least from the studies it looks like that's a smaller group. So overall, the other thing that complicates the process is, if you look at in the school age group that has been the most widely studied and the group that's most frequently diagnosed in treatment, the rise in prevalence has not been all that great, all that large. It's much larger with the fact that, with the realization that it doesn't end in puberty and that you actually have adults who still have the condition. So when you look at the overall prevalence, it's higher, but when you look at prevalence by age, you see a lot more variation.